Hello, Dr. Hill. Another video coming your way. So I don't know if you saw the last one. If you haven't, go check it out. She's hopefully going to put a thing right here so I look like I know what I'm doing. We're going to do a part two of the same situation. We're going to see these Reddit questions together. We're going to take a look at them. We're going to try to answer them to the best of our abilities and go from there. Let's do it. Should I get sealants as an adult? These are some good questions. I was impressed with the last questions. These are still some good questions right now. First off, let's talk about what a sealant is. A sealant is a protective layer that your dentist office or whomever will place on the chewing surfaces of the teeth, okay, where there is very deep grooves, almost like valleys, okay, in your teeth. Now, the reason that those are done is because that is a very susceptible and a very common place to get cavities or breakdown. Because you got to imagine, if they're so thin in there, it's hard for you to keep clean. Things get stuck in there after you're chewing and eating, stuff like that. That's why sealants are placed in there. We usually do it on back teeth, all the way in the back teeth, on kids as those teeth originally or initially come in. Usually 6 years old for the first set, usually 12 years old for the second set. The reason we do that, they're kids. We want to help protect them. We want to try to, their hygiene usually isn't the greatest of all time. So we want to protect them the best we can. To me, if you are asking me personally, absolutely. If you have deep grooves in your teeth, and if the dentist points out how deep those grooves are, I would 100% get sealants on my teeth as an adult. It doesn't matter your age. 33, I would get sealants right now. I mean, some of my sealants are still in there from a long time ago. But yes, should you? To me, you're asking me, yes. If you have a reason to, with really deep grooves on your chewing surfaces, yes, absolutely get them. It's just going to help protect you in the long run. And so that way you hopefully don't have to get any cavities filled. I mean, nobody wants to get numb and have cavities filled. The beautiful part about sealants, you don't have to numb. It takes 2 seconds. It's great. Great question. Is this post-cavity filling pain normal? General question. We'll try to answer it in a little bit of phases. Okay. First of all, kind of have to describe what is the pain. Is it actual pain? Is it a little bit cold sensitivity when you eat? Is it hot sensitivity when you drink hot coffee? Is it only when you chew? Is it waking you up at night? There's a bunch of definitions of pain that really your dentist and your dental team should kind of work through to kind of help you with a question like this. Actual pain, I'm hoping that your dentist may have told you maybe the cavities was big. Maybe it is a huge filling. Maybe it was close to the nerve where patients could have bigger issues and long-term issues. I hope your dentist would tell you or inform you that is a possibility. But I think the key in this question is really what technically is pain to this person, because some patients, they can be sensitive to cold on a filling tooth, even if it's a small one, for weeks at a time. I mean, up to a month. And that's just how that tooth is or how that patient responds. Other patients, they could have just a pain when they're chewing, which could potentially need what's called a bite adjustment, where you go into the dental office and they kind of just adjust the bite of that filling a little bit. Obviously, temperature sensitivity of something like hot, something like waking you up in the middle of the night, you feeling swollen, things like that, that's a little bit of a different ballgame. That could be potentially more serious. But to me, if this is a question right here, what I do is I call up the office and I describe what my pain is to that person, and that can get relayed to the dentist, or go in and see if they can evaluate you. Normally on fillings, there should be no pain long term, but call your dentist, ask them, describe what your pain is, what kind of pain it is, so that way they can help you out and try to alleviate that for you. Is flattening teeth really that bad? Yes, it is. You want to have anatomy in your teeth. You want to be able to do it. The reason why is because of functioning, okay? When we eat and chew food, we have to chew the food. Patients that have these flat teeth, that have a bunch of wear on your teeth, that literally just kind of polish them off on the top, things like that, it hurts you in the long run. You have issues with potentially your jaw. You have issues with potentially your muscles. And obviously the aesthetics of all these flattening teeth, I'm assuming is what they're talking about, is not good. I mean, it doesn't look healthy. It doesn't look real. There is ways to help protect from flattening teeth, like guards, things like that, that I think are key, that need to be seen by your dentist, your hygienist, your assistant. But in the long run, this is going to be a major problem for you. At my office personally, and I know at a lot of these offices that I've done a lot of larger continuing education courses with, they really are structured to treat comprehensive dentistry, which means we look at everything as a whole aspect of stuff. If we start to see flattening teeth or wear on our teeth, we got to look at the source of it. What's the issue of it? We know how we can fix it, how we can protect it, whether it's a guard, whether it's major invasive work like putting crowns on teeth, things like that. But we've got to get to the bottom of it. Are you doing it during the day if you work? Are you doing it at night while you sleep? Is this something that just recently started happening? Things like that. It's all got to be figured out by your dentist or by their team in your office. But yes, in the long run, simple short answer, because you know I love to talk, is flattening teeth really that bad? Yes. Yes, it is. It is. It is bad. How long can I wait to get a crown for my root canal? Not long. You don't want to wait, okay? I explain this. This is how I explain it to patients. I know a lot of root canal specialists. They're called endodontists, and their thought process is that when let's say they do the root canal, okay, they usually tell the patient that they want to get the patient back into our office between 2 to 4 weeks after the root canal. A lot of specialists like to wait that initial 2 weeks after doing a root canal to make sure everything is fine, to make sure there's no problems, no discomfort, no issues, nothing like that. Then after that, you should be seen ASAP. Why do you have to put a crown on a root canal tooth? It's now kind of standard of care in the back teeth, okay? The reason why, root canal goes through the tooth, we take away some tooth structure, you're weakening that tooth structure, and what you want to end up actually doing with a crown and what it's made for is, as I explain to patients, is that we're kind of uniting that tooth as a single unit. Most people have heard of what a cap is. Imagine this is a cap. Imagine this is your tooth. The cap goes over the tooth and it strengthens it as a single unit, okay? That way it's not divided up anymore. So to me, I stress this on patients all the time. Get back as soon as you can within what the specialist tells you. Usually it's about 2 weeks after that. Get back in as soon as you can to your general dentist to make sure you can get that crown on there, okay? We want to make sure that crown seals off that tooth so no bacteria can get into that tooth that you just had worked on, okay? We want to make sure you're taken care of. I would say you're looking at about 2 to 3 to 4 weeks right after your root canal. Make sure you have no discomfort. Make sure you have no pain. Get that crown on there. You're going to be a lot happier. It's also going to save you a lot of money and time in the long run. Longevity-wise, the best route to go, always. Great questions. These Reddit ones are good. I like these. These are actually pretty interesting. And to be fair, questions that I see a lot of or get a lot of when I'm in the office. So send those questions to us, and then that way I can look at them, I can view them, I can tell you what's going on, and we can kind of do some more cool dental stuff. Appreciate you all. Like, subscribe. We'll see you soon.